talk about hypnosis, like that our patients hypnotize us.
Yeah.
That's a really cool concept. Can you say a few words about that?
Well, I call this reverse hypnosis. There's 3 forms of reverse hypnosis. That's where the patient hypnotizes the therapist rather than vice versa. And therapists go into trance, and patients go into trance, in and out of trance all the time in sessions without being aware of it. And for example, reverse depressive hypnosis is where the patient convinces you that they really are worthless and hopeless. And I don't think I've ever had a depressed patient who, at the beginning of therapy, I didn't start buying into what they were saying.
Yeah.
And they're thinking, oh, I'm so depressed, I'm so worthless, I'm so hopeless, my life is overwhelming, and they start talking about all of their deficiencies. And I don't think I've ever had a patient that I think
yeah.
maybe this person really is a worthless loser. They've got me convinced.
Yeah, you're kind of going with them.
Exactly. And then 3-4 sessions later, they're suddenly turning it around, and then I see how distorted and unrealistic that was. But I got fooled. And the thing is, if you buy into that, as therapists are sometimes trained to do,
Right.
even the drug companies train doctors to say to patients, you will struggle with depression throughout your life, and this medication can help you a little,
Yeah.
but you'll always have to take it. You're always going to be struggling with depression.
It's a constant state. You're stuck with it forever.
Exactly, exactly. And once the therapist buys into it, or the psychiatrist buys into it, the therapy's doomed. Anxiety reverse hypnosis is a little bit different. What does every anxious patient have to do to be cured?
Exposure.
Exposure.
Exposure work.
Exposure. And no anxious patient is going to want to use exposure. Exposure alone isn't enough to cure most anxious patients. But exposure has to be a part of the treatment package. And the patient will say, please, doctor, I'm not ready for exposure. They're shy. I don't want to go out and talk to strangers. I don't want to approach strangers and use self-disclosure and say, you know, I've always been shy and I've been hiding it and I've been ashamed of it. I'm decided to start telling people, and
Right.
I'm telling you,
Right.
that type of thing. And that's a very powerful exposure technique. The patient isn't going to want to do it. And so the therapist buys into that, and you tell yourself the patient is too fragile to do exposure. And so therapists don't do it, and then the therapy is doomed.
I can't ask him to do that. It's too much for him.
Yeah. That's right. And surveys show that 3/4 of American therapists, and probably worldwide therapists, do not use exposure in the treatment of anxiety, and that's the reason, because of this reverse hypnosis. And then relationship hypnosis is, let's say you have a patient and they're saying, oh, I'm not getting along with my husband, my brother, my neighbor,
Right.
my colleague at the workshop here, I'm so angry and upset. That person, 9 times out of 10, will be trying to sell you on the idea that they're a victim,
Right.
an innocent victim of the other person's bad behavior.
Why is that a problem in your eyes?
Well, because blame is the cause of virtually all relationship problems. You cannot resolve a marital conflict or a conflict with your neighbor or with anyone if you're blaming that person. You've got to be willing to examine your own role in the conflict and focus on changing yourself. But the point is that therapists will buy right into the patient's formulation. They say, oh, you're so right, your husband can't deal with his feelings. Even schools of therapy have been based on these kinds of formulations. And so that's relationship hypnosis. And today, the last day of the workshop, we're going to do interpersonal therapy, and that's going to involve the death of the therapist's ego in yet a different way. Because and I'm going to have all of the participants here, I'm going to work with them both as patients and as therapists, and ask them to examine a conflict that they have with their spouse, their son, their mother, whoever, and they're going to discover their own role in the conflict. And there's going to be a lot of tears today, because it's pretty crushing to suddenly see this thing.
It's kind of embarrassing.
It's embarrassing, it's humiliating.
But it's also wonderful.
But it's liberating,
Right.
because if you can see suddenly how you're causing the other
Right.
person to treat you the way they are, then you're empowered to change the way you're interacting with them, and then the other person will immediately change. The moment your ego dies and you bring a different warmth, a different openness to the relationship, the other person will do the same thing.
Gives you back the power.
Yeah.